One giant leap for mankind.
Radio Cayman in the Cayman Islands.
This is For the Health of It with Tara Bush.
Brought to you by Healthcare Pharmacy, where they care about your health. 2 locations, Governor Square and Grand Harbor. Refill and transfer prescriptions online. Call 947-8900 or visit healthcarepharmacy.ky.
And UHealth, International University of Miami.
World-class healthcare in the heart of Miami.
The Light Room, your holistic sanctuary for physical and mental restoration, repair, and rejuvenation. The power that made the body heals the body. 38 Pasadora Place, Georgetown. Find us online at www.thelightroom.ky or call 938-HEAL.
For the Health of It with Tara Bush.
Running on empty? Feeling depleted? Health and wellness comes down to one essential factor: energy at the cellular level. Our body is designed to support, repair, recover, and heal, but it needs the right environment. At the Light Room, our energy enhancement system is that right environment, a balanced bioenergetic support for your body's natural processes. Don't wait until your energy is depleted. Recharge and keep optimized. Start today. The Light Room, advanced energy therapies that work. We're in Pasadora Place.
There's nothing more important than your health, and seeking expert healthcare with physicians you can trust is what you deserve. UHealth, the University of Miami Health System, offers peace of mind to you and your family with a first-class experience. Our patient coordinators assist with everything you need before, during, and after your stay with us. As South Florida's only academic-based health system, UHealth offers cutting-edge treatment, compassionate care, and life-changing results just a flight away. Learn more at umiamihealth.org/international.
Your health is everything, and it's important to have a doctor who cares. Dr. Sidney Ebanks, proud Caymanian, has a big heart for his community, specializing in complex cases, urgent care, and preventative medicine. Dr. Ebanks offers over 20 years of experience. He listens to your needs, your frustrations, and what you're experiencing. He treats more than just the illness. He treats you. Dr. Sidney Ebanks, where care meets compassion. Because every patient deserves a dedicated doctor who cares. Call Dr. Ebanks at Grand Harbor Medical today at 949-4309.
Hello and welcome to For the Health of It. Today, I will be interviewing Dr. Bruno NAHAR, who is an associate professor of urology at the University of Miami. Hello and welcome to For the Health of It.
Hello, thank you so much. It's a pleasure being here today and having this interview with you.
Well, thank you. So for people who may not know, what exactly do you do? Urology, it's not just your bladder or peeing, right? It's a little bit more than that.
That is correct, yes. So I'm a urologic oncologist, and essentially this is a subspecialty of urology, which is focused entirely on cancer. Instead of treating the full range of all urologic conditions, urologic oncologists, we narrowed our focus specialty to cancer of the urinary tract and the male reproductive system. So the most common cancers we see are prostate, bladder, and kidney cancer. But we also treat other types of, more rarer cancers such as, penile and testicular cancer. If it involves the urinary system and it's cancer, that's our world.
Okay. Odd question. You do both men and women because both men and women have urinary cancers.
That is correct, yes. So, prostate cancer is probably the most common cancer in urology, and that affects only men, of course, but kidney cancer, bladder cancer can also affect, women.
Right. So you're not going to come and see you if you have a urinary tract infection?
No, you're probably going to see one of my colleagues, correct.
Okay. So what is the most common urologic cancer in people other than prostate cancer?
Yes. So prostate cancer is by far the most common, as I mentioned. So about 1 in 7 men, 6 to 7 men will be diagnosing during their lifetime. And that's why we screen for it. Kidney and bladder cancer are less common, but still something that we see every day. Kidney cancer rates are actually going up because, mostly because we're doing more imaging and we're picking up some small masses that we wouldn't have found before. So these are the most common cancer in urology.
And prostate cancer we used to think about it more as a benign cancer that more than likely something else would kill you. But some types of prostate cancer can be quite virulent, especially in Caribbean, Hispanic populations.
Yes, you're correct. So I usually say that prostate cancer comes in different flavors. And it's very important that once you diagnose prostate cancer, you can risk stratify all the patients. So you can have the low-grade cancer, you can have what we call intermediate grade, and also the high risk, right, high-grade cancer. And you're right, if you have a low-grade cancer, most likely the chance of you dying from a low-grade cancer in 20 years is likely 0. So that's why we usually watch these patients and we don't offer any invasive treatment, right? But if you have intermediate or high-risk cancer, then you're more likely to undergo treatment. And that's why it's very important to see a urologist and discuss all these options.
Okay. And do we now understand why that Caribbean or people of African descent or Hispanic people have the more virulent cases of cancer, or research hasn't found that out yet?
We believe it's a combination of things. One of them, of course, I think there is a genetic component. Like Asians, for example, they're less likely to have prostate cancer. African American, Caribbean, they're more likely to have prostate cancer in the more aggressive type, as you mentioned. So I think it's a combination of both the biology of the tumor and sometimes, depending on the location, access to care as well. Because, prostate cancer, if you detect it early stage, it's highly curable.
Okay. So it's not linked to lifestyle, like, dietary. It's more genetic in nature, that kind of thing.
I think lifestyle and diet do play an important role, but we still haven't figured out how it impacts and what we can do to prevent it.
Okay. Many men avoid going to see a doctor until they can't pee anymore. Or, it's very serious, and it's usually their wife taking them to the doctor at that point. What are some of the signs that you just say, do not ignore? Yes.
So prostate cancer, we were talking about prostate cancer. It's more of a tricky disease because it's mostly a silent disease. So you can have it and feel completely fine, right? Urinary symptoms, as you mentioned, they are, like slow flow, frequency and all those things. They are usually from an enlarged prostate, which is benign, not cancer. Right. So for prostate cancer specific, it's very important that you, if you're above the age of 45, or if you have family history and above the age of 40, then you should definitely see a urologist for a PSA testing, which is the biomarker, the tool that we use for screening. But for example, you talked about, warning signs. Bladder cancer, on the other hand, tends to show up with blood in the urine. So, and that should always be investigated. It's not normal to have blood in the urine. Kidney cancer is usually found by accident. We call it an incidental finding. So a patient gets a scan or an ultrasound for something else, and we spot the mass. So the takeaway, my opinion, is, don't wait in terms of prostate cancer, don't wait for you to have some symptoms. Just, if you're at an age where screening is recommended, go see your urologist. Okay.
And for women, What are some signs? Is it the same thing with the bladder and kidney cancers, or are they a little bit more symptomatic?
Yes, in women, so when we talk about essentially kidney cancer and bladder cancer, so bladder cancer, in my opinion, would be the blood in the urine. That's the one. It should never be ignored. A lot of times, blood in the urine turns out to be a kidney stone. In women, urinary tract infection, very common. But we always need to rule out bladder cancer and kidney cancer as well, especially if there's a history of smoking. Smoking is highly associated with bladder cancer. So a combination of smoking plus blood in the urine is a red flag, and we need to investigate.
Okay. Getting back to prostate cancer a bit, it affects so many families, and men in particular, it's their I guess it's when they think of prostate, they think of the sexual organ, and so it causes so much angst, right? When should they start to screen for prostate cancer?
So there's been a lot of debate around this, but screening works. The evidence is clear. The controversy around screening isn't really about whether to screen, it's about who to screen, when to screen, and what to do with what we find. And we talked about this earlier. Not every prostate cancer needs treatment. The low-grade disease, we can just often monitor. The problem is, in the past, that there was a connection between the detection and treatment. So anyone who got prostate cancer diagnosis would get treated. And it shouldn't be like that. So we have to, it's not a one size fits all, it's more of a personalized medicine. And we need to risk stratify the patient first before we decide what to do next. But my recommendation is to start the screening at the age of 45. If your PSA is very low at that age, that's actually very reassuring. And it tells us a lot about your, let's say, long-term risk. But if you have a strong family history, right, which again increases your risk of having prostate cancer, I would recommend starting at the age of 40.
Even if you're, in that, not just the family history, but you're in that race group of African American or African Caribbean.
Correct. If you have risk factors, is the reason I mentioned family history is just because it's one of the strongest risk factor. But yes, so African American and Caribbean, the Caribbean population, so they could also start at the age of 40, especially if they also have a family history.
Okay. There are often fear and information around the PSA testing and prostate exams. What do you want men to understand?
So PSA testing, and again, the way PSA testing was introduced in the late 80s, early 90s, didn't do it any favors, because for years we used this cutoff, which is totally arbitrary, right? So if your PSA is above 4, you need a biopsy. If your PSA is below 4, you're fine. That's not how it actually works. So PSA is just one piece of that puzzle. So there are many other things that can elevate your PSA, and they have nothing to do with cancer. Enlarged prostates, inflammation of the prostate, infection, sexual activity, all those things can elevate your PSA. Today, we rarely use PSA alone to decide on the need of a biopsy. So we have MRIs, for example, which is a scan, and it acts like a GPS kind of thing. It shows us exactly where a suspicious lesion is. And even if you have to do a biopsy, you can even use the MRI to do a targeted biopsy and a more precise biopsy. We have other markers, molecular blood biomarkers, that help us identify who actually needs a biopsy and who doesn't. The main goal nowadays with PSA testing is, and all the other markers available, is a combination of all these tools to avoid unnecessary biopsies in men who are really low risk for prostate cancer.
Okay. Is there anything else that you want us to know about the testing process. I mean, we have a lot of testing in Cayman for PSAs. Are you saying that doesn't make sense? Or go and have it done because it is a marker?
No, I think PSA is the first marker. So you use a PSA as a screening tool. So everyone should get an initial PSA testing. If your for example, if you start your screening at the age of 45 and your PSA comes back very low, so let's say below 1, the chances of you actually having cancer during your lifetime or cancer that needs treatment during your lifetime, it's very low. It's like around 1%, right? But if your PSA is high at that age, then of course you need to do further investigation, because PSA stands for prostate specific antigen, not prostate cancer specific antigen. So it's specific for the prostate, but not specific for cancer. So if your PSA is elevated, you have to rule out other conditions that can elevate your PSA. But of course, cancer is one of them. So that's why using PSA alone as to detect cancer or the risk of having cancer, I think that's something that we used to do in the past, but nowadays we have, more resources to really select only those patients who have high risk of having prostate cancer for a biopsy, and not biopsying everyone.
Okay. What advances are happening in treatment now that give patients more hope than ever before? Are they targeted therapy, precision medicine, less invasive? What do you do?
Yeah. I think this is the field, especially in prostate cancer, is moving towards less aggressive, more targeted treatment. Robotic surgery, for example, is now, I would say, standard of care for prostate, bladder, and kidney as well. It's minimally invasive. There are fewer complications, less pain, less risk of bleeding, blood transfusion, faster recovery. So this already has been a game changer in the treatment of any urologic condition. But I think what's really changed the game for prostate cancer, or is gaining more and more popularity, is what we call focal therapy. So focal therapy is essentially for very, very selected patients, carefully selected patients, not for everyone. We can treat just the area where the cancer is and leave the rest of the gland alone. And that minimize all the side effects and complications that come from whole gland treatment, such as surgery, such as radiation therapy. So focal therapy is, in terms of maintaining the quality of life, a very, very, very good alternative for some patients. And when I mean preservation of quality of life, it's essentially urinary function and sexual function, and in a way that wasn't possible before with surgery and radiation.
Okay. What do you want men to think about when they might be getting a symptom or have heard, a friend getting cancer or some family member or whatever? What would you want someone who's listening right now who has been thinking about going to a doctor, not you per se, but just the first stop, and who may be experiencing something? What would you want them to know?
So, first of all, don't panic. Whenever you hear the C word, the cancer word, everybody kind of panics, right? But even patients with advanced disease nowadays are living longer than ever before, and that's because the treatments have improved dramatically, and that's across prostate, kidney, and bladder cancer, even in advanced, even patients with metastatic disease. But the most important thing is still early detections. Most urologic cancer, right, when caught early, are highly, highly curable. Prostate cancer, kidney cancer, bladder cancer. So if you have any symptoms, right, if you have blood, if you smoke and you have blood in the urine, or if you did a scan and you found something, an ultrasound or a CT scan, they found something in the kidney, or if you're doing PSA screening and your PSA is elevated, go see a urologist, right? Don't wait until this grows, because if we detect this at an early stage, most of these cancers highly, highly curable.
That's good to know. What misconceptions frustrate you the most about these types of cancers?
Good question. So I believe, particularly for prostate cancer, is the misconception that a prostate cancer diagnosis means you're losing your prostate, and that's just not true. I mentioned this earlier, and again, prostate comes in different grades, different stages, and the treatment has to match the disease. The low-grade cancer, we can often just monitor it. We don't need to touch it. The problem is that, as I mentioned, the men hear cancer and immediately think surgery, and that fear keeps some of them from getting screened in the first place. So get the PSA. Getting diagnosed early gives you options, not necessarily surgery, but avoiding these tests takes all those options away. So get tested, get your PSA screened, and go see a urologist.
Okay. What role does mental health play after a cancer diagnosis?
That's a great question. I think it's a big deal. I think it's very, very underappreciated. A cancer diagnosis doesn't just affect the body, right, the biology, but it shakes everything. So most patients go, and that's not only for prostate cancer or urologic cancer, any cancer. So patients usually go through this recognizable phases, right? The denial, then grief, and eventually they accept it and they come back to you for treatment. We have usually psycho-oncologists on our team. These are psychologists specialized in cancer, and they're specifically for this. But I think one of the most powerful tools that we have is connecting patients with others who've been through the same thing. Someone who had the same surgery, had the same fears, and it came out the other side, right? That kind of peer connection does something that we as a doctor simply can't. Hearing that, oh, you know what? I went through exactly what you're about to go through, and I'm standing here fine. I think that's a very, very powerful medicine. And I only hear great feedbacks from my patients who do this peer connections.
Yeah, that sounds that sounds good. So if listeners could leave this conversation remembering one thing about protecting their health, what would you want that message to be?
Go see a urologist. That's it. I mean, if you have blood in the urine, go see a urologist. If you have erectile dysfunction, go see a urologist. If you're having urinary symptoms, women with recurrent urinary tract infections, they are bothering you, go see your urologist. Most of the time, what we find is completely treatable, right? And remember, for prostate cancer specifically, there are no symptoms until it's advanced. So the only way to catch it early is a simple blood test. Don't wait for something to feel wrong. By then, you might have lost the advantage. So go see your urologist.
Is it true that younger people are getting these cancers more often?
Well, that's actually a good question. I mean, it's we're seeing more younger patients. That's true, and I think it's likely a combination of many things. But one of them, for sure, we're doing more imaging. Imaging is we're having better resolution, better technology with those images. So I feel like we're finding cancer that would have missed before. But I think there's possibly some real biological changes that we don't fully understand yet. So the trend is real. I think it's something that the field is paying close attention to, but we still don't understand fully why this is happening. But you're right. We are seeing cancer on younger patients.
And going back to this, I said it a little too awkward, I think, the last time, so I want to clear it up this time. Men often struggle to talk about health issues, right? Especially when it comes to this function and their sexual health. How do you suggest that their family members or them, and we as a society, reduce the stigma and encourage our earlier conversations?
Yeah, so erectile dysfunction, it does carry a stigma, right? It doesn't deserve it, but again, the stigma exists and is costing men their health, I believe. And here's something most people don't know, and I think it's an important information. Erectile dysfunction can be the first sign of a cardiac problem, right? So if the blood flow to the penis is affected, and usually by diabetes, hypertension, high cholesterol levels, if that's happening to your penis, it's probably happening to the coronary arteries, the arteries of your heart. They might be facing the same issues. So sometimes just coming to the office to talk about erectile dysfunction might actually prevent a heart attack, because it could potentially be the first sign of as I mentioned, a cardiac event.
Wow.
You mentioned urinary function. Urinary symptoms like leaking, weak flow, not being able to empty the bladder. These are extremely common with aging. There's nothing to be embarrassed about it. And most of this is very, very treatable. So men need to have these conversations with their doctors.
So, Dr. Nahar, how can people from the Cayman Islands reach out to you?
So actually we have so they can reach out to me by email, my social media, and I can provide that to you. But there is an official pathway if they would like to be seen by me. So we do have at the University of Miami a UHealth International department, and we deal with everything from even helping with visa, coordinating travels, connecting you with the right physician, reviewing your medical records. So there's a lot to be done in the backstage, but essentially we try to take away all the burden of traveling, the cultural differences, language sometimes, to make sure you focus only on your health. So if you're interested in seeing me at the University of Miami or anyone else, feel free to reach out to us on the website. It's the UHealth International website, and you can have all the information there.
Okay, thank you so much for that. That's the UHealth website.
UHealth International website.
UHealth International website. Well, thank you for being on The Health of It, Dr. Bruno Nahar. We look forward to having you back, and thank you.
No, thank you so much, Terry, for the opportunity. I think we had a very nice conversation. We touched on very important topics, especially cancer in both men and women. So again, it was an absolute pleasure, and I hope to come back again.
Dr. Nahar, thank you for joining us from the University of Miami, for sharing your expertise on urological cancers, early detection, and the importance of paying attention to early signs. We appreciate the work you do, and thank you for being with us on For the Health of It. We are moving you to the life you want.
Running on empty? Feeling depleted? Health and wellness comes down to one essential factor: energy at the cellular level. Our body is designed to support, repair, recover, and heal, but it needs the right environment. At the Lightroom, our energy enhancement system is that right environment, a balanced bioenergetic support for your body's natural processes. Don't wait until your energy is depleted. Recharge and keep optimized. Start today. The Lightroom, advanced energy therapies that work. We're in Pasadora Place.
If you or your loved one is facing cancer, only Sylvester will stand firmly by your side at every step, from diagnosis through survivorship, providing you and your family peace of mind and assisting with everything you need before, during, and after your stay with us. Sylvester Comprehensive Cancer Center is South Florida's only NCI-designated cancer center and specializes in treating the most complex cancer cases. Your first-class cancer care is just a flight away. Learn more at sylvester.org.
When I first started going to Healthcare Pharmacy, it was because it was convenient. But over the years, I continued to shop there because I trusted them. One day I was picking up my prescription, and the pharmacist noticed an over-the-counter medication in my basket. She said, "I hope that's not yours. It will interact with your prescription." And I thought, wow, thank you. Trust is so important when it comes to your health. Healthcare Pharmacy, with 2 locations, Grand Harbor and Governor Square, where they care about my health.
This is For the Health of It with Tara Bush.
Brought to you by Healthcare Pharmacy, where they care about your health. 2 locations, Governor Square and Grand Harbor. Refill and transfer prescriptions online. Call 947-8900 or visit healthcarepharmacy.ky.
And UHealth, International University of Miami.
World-class healthcare in the heart of Miami.
The Light Room, your holistic sanctuary for physical and mental restoration, repair, and rejuvenation. The power that made the body heals the body. 38 Pasadora Place, Georgetown. Find us online at www.thelightroom.ky or call 938-HEAL.
For the Health of It with Tara Bush.
Information, entertainment, inspiration.
Covering Grand Cayman, Little Cayman, Cayman Brac.
Since 1976 till now.
Radio Cayman in the